So I would say the state of it is one of slowly improving. Let me talk about my community. I'm in Lorain, Ohio, like I mentioned, near Cleveland. So we're Midwest. The hospital where I practice is a community hospital. Our community lost 141 lives to overdose last year, and we were able to cut that down to 119 this present year. And I have been working as the medical director for an opioid treatment program for about 3.5 years now. And what I have seen throughout this time is, a lot of stories about how we could be better in the ER or in triage or in inpatient context with respect to, treating patients with dignity. But I have also seen that by my own efforts, just connecting with colleagues, whether it's, writing a letter to somebody like a consultant and saying, hey, I have this patient who is on, methadone for opiate use disorder. And then I've kind of developed a educational kind of list of bullet points like, hey, just wanted to let you know, this patient's doing well, or, if you're prescribing other medications that have sedative effects, like be careful. I would encourage you to, monitor, their EKGs, for instance, if it's methadone, and be careful prescribing drugs that do X, Y, Z. I feel that has helped other clinicians be willing to kind of treat these patients better. And that's the feedback I get too. Another simple thing I've done is just give my phone number to the ER director and made sure that, hey, if any of my patients come in to the ER, do you mind giving me a call just to let me know? And so that's provided a lot of opportunities, just to answer questions. Hey, this patient came in, said that they were not able to obtain the medication that was dispensed during dosing hours at our opioid treatment program. What do we do? And so then I, can take a couple minutes and be like, here's a little bit about the pharmacology of methadone, and, update them about the fact that they are allowed to treat people in opiate withdrawal without having any special license in an ER, at least up to 3 days. And those sorts of things, mostly education, communication, and networking with other colleagues has been helpful at improving the status of stigma within my community. Culturally, I would say that mental health is, huge now. Certainly if you look at any content creation platform, there are so many people opining about mental health topics, addiction definitely being one of them. Not all of it's good. There's a lot of personal stories being shared, which I think do have value. And so the conversation is getting out there. I think the biggest problem is the fact that there's a disconnect between the world that people who suffer from opiate addiction in particular live in, and those who don't. And getting these two kind of communities to understand, especially the non-affected people in our communities to understand the plight of those families and the individuals who suffer from addiction is is something that we all can kind of do through, our sphere of influence, even if it's two, three, four people. If those two, three, four people are treating patients, then that does have a measurable, noticeable impact in a community or in a hospital system. So I could really ramble on this.